Let's join for the invocation by Chaplain John Gerhardt.
Thank you, Chairman. Would you bow your heads with me? Lord our God, the refreshing winds that blow remind us of the change of our seasons. We've experienced one of our busiest summers ever in providing care for the residents of our community, and we are reminded now of the seasonal visitors who come our way. They come to enjoy our beautiful beaches and our vast ocean, but while they are here, unfortunately, many of them will need our care. Grant us the resources to care well for them, with clinical excellence and with the deepest of heartfelt compassion. We pray for your guidance and your provision as we seek to be faithful in the high calling of this ministry of healing. These things together we pray. Amen.
Pledge of Allegiance. Pledge
allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Call the meeting to order of the Sarasota County Public Hospital Board on October 19th, 2015. Any citizen desiring to address the hospital board should turn in a speaker card to the board secretary. If the citizen comment pertains to an item on the agenda today, the comment will be heard early in this meeting. Otherwise, it will be heard toward the end. Speakers are asked to limit their comments to 5 minutes. Vendors, suppliers, or other persons seeking hospital contracts awarded on a competitive basis are reminded that their ability to address the board may be restricted by the terms of the invitation for bid, request for proposal, or other purchasing criteria. Lastly, the board has established a claims adjustment review panel comprised of representatives of the board, the medical staff, administration, and legal counsel to review and negotiate the settlement of claims. Accordingly, the board will not entertain comments on or discuss or negotiate claims at this meeting. We need approval of the orders of the day, please.
So moved. Second.
Any comments? If not, all those in favor of the motion, please indicate by saying yes.
Yes.
Thank you. Motion passes. And next, approval of the minutes of the meeting of September 21st, 2015. The tax, thank you. We have a little bit more. The tax, millage, and budget hearings of September 8th and September 21st, 2015.
So moved.
Thank you. Thank you. Any comments or questions about that? If not, we'll approve these minutes as written. Right? Okay. Yeah, you need to say yes, that's true. Everybody who's approving all three of these, please say yes.
Yes.
Thank you very much. And now we'll move on to a flu update. Dr. Steve Taylor, our Chief of Medical Operations, is the speaker today. Did you want to say a few words of introduction, Dr. Fiorica?
No, I think everyone knows his reputation and his knowledge.
Absolutely. Thank you.
Thanks, everybody. Well, good afternoon. So what's all this hubbub about? It's just the flu. I mean, what are we so worried about? What comes to mind when you talk about a really lethal epidemic viral infection that you hear a lot about in the news these days? Ebola, right. So guess how many people have ever died of Ebola? Anybody want to take a guess? 13,000 people, ever. And as you can see from the slides, 10% of people in the U.S. become infected with influenza every season. And we have upwards of 30 to 35,000 deaths in the U.S. every year from influenza. Worldwide, 250,000 to 500,000 people die of influenza every year. But yet, there's all this hubbub in the press and on TV and newspapers about Ebola. It's true, Ebola is a virulent disease, but it's usually self-limited. It burns itself out. Influenza, on the other hand, is very contagious, spreads in large-scale epidemics throughout not only the United States but the world, and kills a lot more people every year than Ebola has ever killed. So that's what this is about. And the best public health response to these yearly epidemics is vaccination. It sounds pretty simple, just get a flu shot. But what you're really thinking about here is the public health aspects of it. This is not about one person or another person. This is about the public health aspect of getting a critical mass of people immunized so that it's difficult for influenza to be passed from one person to another. By getting vaccinated, we're essentially creating barriers within the population that stops the spread of the disease. So this is what the current year vaccine looks like. I don't expect you to take notes on all this because I can't remember this myself, but the point of it is just to let you know that every year the scientists who make the vaccine try to predict. It's a prediction, and it's based on what's happened in prior years and in cycles of the influenza vaccine. And this is just to show you that this year's vaccine is a combination of two A types and two B types that are thought by the experts to be the ones most likely to cause outbreaks of influenza this season. So influenza evolves rapidly. The strain used in the vaccine must be constantly updated. That's why it changes every year. H3N2 evolves significantly faster, and partly because of this is usually responsible for the majority of seasonal morbidity and mortality. It was a bad flu season last winter that I'm sure you're all aware of, and that was a result of a gene mutation, so that what was in the vaccine was not exactly what was out there later on being spread throughout the community. This is just to show you what can happen when an organization really decides to put its mind to a vaccination program. Virginia Mason, which some of you may be familiar with, a hospital system on the West Coast. You can see the numbers. Pre-intervention, 30% immunization rates, but with a full court press, they're up to 98%. BJC in St. Louis has hit 99%. We have done pretty well here at SMH. Last year, our hospital staff were 92% immunized, and the medical staff were 94% immunized. So that's really quite good, considering in the past we were down in those same ranges, 30, 40%. So the upshot of it is that it's a public health measure. We're not doing this just to prevent one person's influenza illness or another. We're doing it as a public health measure to stop the spread of the disease in an epidemic fashion throughout the community. It's true that folks who are young and healthy do pretty well even if they get influenza, but think of all the patients that we see in our hospital, folks who have chronic lung disease or diabetes or heart disease. For those folks, influenza can be a fatal disease, and often is. So that's why we're going through, all the effort of making this a mandatory immunization program at SMH. Mandatory to us means that there's really only maybe one reason why folks shouldn't get a vaccine, and that's if they've had a severe Guillain-Barré type of neurologic problem with a prior vaccine. Even the quote, I'm allergic to influenza vaccine doesn't really work anymore, because there are preparations, there are vaccines that don't involve the use of egg products at all. There's also a nasal vaccine that can be used. So there should be very few so-called legitimate reasons for an exception to being immunized. There are going to be a few, though, in both the hospital staff at large and the medical staff in particular. And for those folks, the public health answer to that is, okay, if you absolutely don't want to be immunized, you have to wear a mask when you're here, because it's still a public health measure, Our patients and their families are walking up and down these halls, and they're in our rooms. So we need to do the best job we can. So folks who haven't been immunized will be required to wear a mask when they're in the public. And the other thing that we experimented with last year with the medical staff, and we're going to roll out hospital-wide this year, is we're going to change their badge. If the folks didn't get an immunization, they're going to turn in their regular badge, and they're going to wear a badge that has a red ring around it. Just so that if you see somebody down the hall and they've got a red badge, but they're not wearing a mask, you can remind them. You can say, wear a mask while you're here in the hospital. We did have some trials of this last year and worked pretty well. One of our physicians, who was a suitable human volunteer, he had been immunized, but he wore a red badge, and several people asked him about it and asked him if he'd been immunized. So we're going to do this on a larger scale this year. And that ends the discussion, unless you have questions. How many of you have had your immunization? And the rest of you plan to, right? Yes. Okay, great. Any questions? This is one of those where like we said at Management Council the other day, there probably really shouldn't be any questions at this point. It's kind of a slam dunk, right? Mm-hmm. Yeah.
Are there certain age groups that are more susceptible?
Well, the infection rate is about the same across the population, but it's the impact that the infection has on different population groups that's what's most important. Folks who have chronic diseases, the elderly, the very young, are the most susceptible to having a severe infection or even a fatal infection. But the attack rates are about the same. It's about 10%. Any other questions?
Thank you so much.
Thanks so
we
much.
appreciate it. And we have an Excel winner, but she's not here at the moment, so we'll just go on and hope that perhaps she's able to make it. Something must have come up. So we'll move on to the report of the medical staff. Dr. Jim Fiorica, last time to say Chief of Staff.
Yes. So I have one action item for the board to consider, and that's the approval of the anesthesia department rules. This action item is actually going to be a series. Today's item will be a series of several rules. We're updating all the departments in the hospital. So over the next several months, you're going to see many of these rules come through, but this is the first as we're updating all our hospital department rules. This was approved by the Medical Executive Committee, seeking your approval.
Madam Chair, I'd like to propose a motion.
Yes.
I move approval of the anesthesia department rules as recommended by the Medical Executive Committee.
Do we have a second?
Second.
Any comments or questions? If not, all those in favor of the motion, please indicate by saying yes.
Yes.
Opposed? Motion carries. Thank you.
That concludes my report.
Well, Dr. Fiorica, we'd like to take this moment on behalf of the whole board to thank you so very much for your outstanding leadership as Chief of Staff. So many things have been done this past year with your leadership, and I know the help of others. It takes a team to do it, but you really have just done a marvelous job. And we thank you so very much for your service to our hospital system. And as we think of trauma, and as we think of graduate medical education, and as we think of the oncology developments, your name will certainly come to the forefront of our mind about all of that. So thank you.
Thank you again. Thank you very much for having me. I was pleased to serve. I wanted to make sure I made an impact for now and for the future. And again, I had a lot of help surrounding me. Thank you.
Thank you. And Dr. Hammond, we'll look forward to seeing you in that chair next month. So we'll move now to the auxiliary report. Ed Miller, auxiliary president.
Thank you, Madam Chair. My report today will focus on the state of the, since this is the first meeting of the year. Financially, we're in good shape. In our checking and savings accounts, we have a little over $160,000. As you know, this money is raised by our vendor sales, as well as the appreciation appreciation of the accounts. This past year, we raised about $11,000 in our vendor sales. We have 5 sales per year, and generally, they are good money makers, considering the effort that our volunteers put in. Closing the hospital for the bomb scare resulted in a loss of revenue from that account. We do put this money to good use. We furnish scholarships to graduating local high school students who wish to continue their education in the medical field. Currently, we're supporting 18 young people in that program. All are selected by a team of hospital education employees and members of the auxiliary. Each applicant must submit a form showing the desire they have to continue their education, their goals, and a record of the economic need in order to be selected. Participate in an interview process. We usually get 4 a year. Last year, we were overwhelmed by the quality and need of 2 other applicants. We granted 6. We have set aside the sum of $90,000 to fund these students who all in different years of their scholarship. But our most important goal is that of furnishing trained volunteers to be able to serve the staff, patients, and visitors of our hospital in a competent, caring manner. Our focus among the incoming board will be find ways to attract more volunteers. We are beginning this process as our new board members become acquainted with the need. Recognize that new positions are being made and that we must be ready to accommodate the hospital's needs. An example of our proactive approach is the almost seamless integration of the relocated surgical waiting area to the first floor of the courtyard tower. Another initiative is the activation of a program to review, analyze, and implement a new model for patient discharge services. Ideas from volunteer staff are being discussed with hospital staff to ensure timely and considerate discharges, a much-needed service. We also are anticipating probable future staffing requirements for the new rehab center and trauma center. In conclusion, the state of the auxiliary is good, and we feel we have the broad spectrum of board members and members at large necessary to continue our service to Sarasota Memorial Hospital. Thank you.
Thank you for your good report. We'll move on to Sarasota Memorial Healthcare Foundation. Alex Quirrell's president. You have a lot to say. That was a fabulous event.
Oh, this is just getting started. David, you'll love this. First of all, I would like to extend a very special thanks to Carol Ann Kalish, who came in last week, and for our Professional Advisors Network, did a complete and fabulous session on the HIPAA laws and what they really mean and what it does and doesn't mean to different people, and it clarified an awful lot of questions certainly we have with regard to patients and getting to know patients and seeing donors and so on and so forth. So thank you very much for your time. You did an outstanding job. Good. You're on next time. No, I'm just kidding. The next thing I wanted to mention is that on January 11th, and you'll probably hear it again because you will get invitations, we have our annual Women in Medicines program. And our featured speakers will be Dr. Fiorica, talking about robotic surgery for GYN oncology, and Dr. Ken Meredith, GI oncology, and Dr. Alyssa Schulman, who, as you know, is a reconstruction surgeon. And so I just met with the committee chairs this morning, and we're ready to go and have a great time. So we expect a full house, and it's going to complete. It's less of a fundraiser as much as it is meeting the other portion of our goal, which is to educate. So we want to provide as much education to the community about what Memorial is doing. So that is one activity. Key to the Cure was, for those of you that were there, thank you very, very much. We had just around 1,000 people. I don't have the final numbers yet, but it's our 11th year, and of course we've well exceeded our $1 million goal. And that goes to all sorts of cancers to be treated at Sarasota Memorial. So the money is well spent, and the people were wonderful, and I want to thank all those of you that were volunteers, supporters, and sponsors for what we did, and it was a great night. Same day, or Saturday, Dr. Fiorica actually gave a talk at SACS for an elite small group of sponsors and women in particular about women's cancers. Thank you, Dr. Fiorica, for doing that on a Saturday morning. While I was in the ER with my daughter. She's fine, she's fine. She's going to get that flu shot. But everything is good, and I wanted to just share with you who our new trustees are for the coming year. Some of them you know, some of them are returning, some of them are brand new. The chair, starting October 1st, the treasurer will be Lou Levy, the secretary Bill Chapman, at large Dr. Kirk Volker, at large Bill Stanford, past chair Dick Clark, and of course myself. New trustees, new and or returning, as Rich Garrity, Phil Delaney, returning, Deborah Kavanoff. You may know her. She is a very experienced businesswoman in IT who actually created a software that she sold to the government and did quite well, and is very well known in the community in certain areas. Mr. Charles Shivery, who has a background in finance and investment. He will be joining us. And, of course, Margaret Wise, we can never let her go because she is fundraising extraordinaire. I'll also say that we raised in excess pledges, cash, and estate plans over $8 million this year. And finally is that I want to announce, and I hope you don't mind, David, but we worked very hard. Those of you who understand what Town Hall is at Van Wezel, David and I are sharing a day. We will do it commensally. We will be together on this, and we will host the luncheon and the dinner as a premier sponsor, and the speaker is Robin Roberts, who is a cancer survivor herself. She is the anchor for ABC 7 News in the morning, and an LSU graduate. And so David and I have agreed that we are going to sponsor that day jointly and have a great day. So we hope to see you there. If you haven't got tickets, please buy tickets, although it might be a little late. But I'm sure we're going to have some tickets to hand out. But I think it's a good way for us to be copacetic about and compatible about working on, instead of a shotgun, we're going to have about 9,000 people we'll be able to be in front of and tell our story twice a day in one day. So thank you, David, for agreeing to wanting to do this with us, because it's been my goal to get on their agenda, which is not easy to do. So that ends my report, unless you have any questions.
Thank you. What day is that?
March 7th, I'm sorry.
March 7th. So the hospital and the foundation are...
We'll have both the luncheon and speaker, and then the dinner and speaker. We will be the presenting sponsors together.
Very nice. Any comments or questions?
See you there. Thank you.
Report. We'll move on to the Secretary's report. Tom Towler.
Thank you, Madam Chair. The board meets in November on the following days. On the 3rd of November, a Tuesday at 8 o'clock for the board breakfast, 8:30 for the PSI board, 9 o'clock for the quality committee, 10 o'clock the finance committee, 11 o'clock the investment committee, and 12 o'clock the governance committee. Then it meets again on the 16th of November, a Monday, at 11 o'clock for a review of finances, and at 1 o'clock for the public board meeting. That is my report, Madam Chair.
Thank you very much. And to the Treasurer's report, Mr. Joe DiVirgilio.
Just have one item this morning, and that's approval of the bad debt and charity care for the month of September. And I move approval of the bad debt and charity care for month ending September 30th, 2015 in the amount of $13,989,000.
Second.
We have a motion and a second. Any comments or questions? If not, all those in favor of the motion, please indicate by saying yes.
Yes.
Opposed? Motion carries. Thank you very much. Thank you. So we'll go to the operations report, starting with Mr. Bill Wojin, Chief Financial Officer.
Thank you, Madam Chair. Good afternoon. I have for our fiscal year 2015, which is now completed, I have statistical highlights. We hold the financial statements open longer to prepare for the external audit by our KPMG auditor, so I don't have the financial highlights at this time. For the hospital's outpatient registrations, we had in fiscal 15, 408,238 compared to a budget of 412,208. The emergency care center registrations, 116,377 compared to a budget of 101,002. Our average daily occupancy for fiscal 15, 446 patients compared to a budget of 378 patients, average daily occupancy in the budget. And our average length of stay was 4.99 compared to a year ago at 4.69. Admissions for the fiscal year, 28,042 compared to a budget of 26,302. And our surgery cases for the year, 19,918 compared to a budget of 18,679. Births, 3,347 compared to a budget of 2,929. And our case mix index for the year, for all patients, 1.72, and for Medicare patients, 1.92. Madam Chair, that concludes my report unless there's any questions.
Any questions? Thank you very much. So now Ms. Jan Mock, Chief Nursing Officer.
Good afternoon. I'd first like to start out by saying a thank you to the board and to the entire organization for a very successful 2015 year. I think you'll find David's report that we did very well in all the pillars. This is a picture. This month, we went to our annual Magnet Conference in Atlanta, and I want to thank Alex and her team for helping support them to get there. As we enter on our fourth journey of Magnet designation, we like to share this very inspirational time with our staff. So we had 10 people go. 8 of those were staff people. And the theme was world-class nursing, innovative patient care. And there were 9,300 people in attendance, the largest ever. And we learned many best practices that we're already doing, but we also always learn a few things that we can bring back on our journey of excellence as we go on our fourth journey for Magnet designation. The next slide is one of our great accomplishments over this last year, and that is in our service pillar, when we hit our stretch goal there of 9 out of 11 for the first time in our history. And we made that in 9 out of the total 11 domains. And on Friday, with our manager of patient experience, Judy Weiser, preparing it all, Lori Lang and I went and visited those areas that were able to achieve the goals. And we had, as you can see here, the theme, and these are the different units as we went on our trip. And they really enjoyed the pumpkins, and we put healthy food as well as chocolate in there, which they always like. And the rounds were made on both the day shift and the night shift. Also, as you know, I think was already mentioned, we opened a week ago, Monday, the new waiting area for our surgery patients' families down on the first floor. This is just a shot of that, and we want to thank the volunteers for their help and support and the whole organization. I do want to recognize Karen Benedict, the director of the Perioperative Services and her team for a very quick transition in making this happen. It is a best practice. And I also want to thank Peter Taylor, who he and his team develop an app that keeps patients informed. And so as we tweak this new location, and as we work with our surgeons and our families, we hope to make it the best that it can be. So I want to thank everyone for that. And the last thing I have is, as you all know, as Lori presented so greatly to you, the work that's been done on creating capacity through redesign and technology. We are working well under our way on that whole process. We started our discharge process redesign, and it's begun, and we're well on our way there. And we also identified areas for creating beds for capacity. So we were able on our first phase, when the volume gets there, of a total of 650 patients. Remember, last year we had a total about 3 times of 615. So we anticipate, because of our volumes that have increased over the last year and even through the summer, that we're going to get to that 650, as David always had told us to be prepared for. That meant 34 beds we were able to identify on our current units that had offices, very functioning offices, whether they were advanced practice nurses or case managers. We'll have to vacate, and we're finding new locations, but that created 34 additional beds. And then we have phase 2, where if we need to expand beyond the 650, we can go to 672. And that's looking at all the other areas within the organization, whether it's procedural areas that we would need to fill if we had to explore that capacity. And then we have that crisis patient volume that we can go up to 718. And we also have been very successful on the hiring of nurses. And as of last week, we've hired 134 nurses, because it's not only okay to have bed capacity, but we have to have staff to care for them. So a lot of work is going on. And obviously, as you know, the new year has started very strong, and we have the capacity and the staff planned so that we can manage that throughout our organization. So thank you. Unless you have any questions, that ends my report.
Good, thank you very much. Good job. We have no board reports today, so we'll move to committee reports. Audit Committee, Mr. Darrell Henry, Chairman.
Thank you, Madam Chair. The Audit Committee met on October 2nd, 7 a.m. Mark Thornton, Director of Audit Services, reviewed fourth quarter reports and discussed completed unit audits, which included SMH safe practices, drug diversion prevention program, duplicate medical records and visit numbers. Also discussed were the audits involving security of the building perimeter, market share analysis, and follow-up security audits. Mark also presented a schedule of risk rankings. Audits in progress and/or planned for the first quarter include the ongoing drug diversion program, which I'm particularly proud of. Hope you all have been paying attention to what Mark's been doing in that area. Doing a really marvelous. He and his staff are really doing a wonderful thing to prevent drugs that ought not get out of here without control from getting out. He's doing a really good job of that. Thank you, Mark. Mark Thornton presented the audit services plan for 2015 and 2016. Mr. Meister, seconded by Mr. Strasser, moved to recommend full board approval of the plan. Motion carried unanimously. Therefore, I move approval of the audit planning process for 2016 as recommended by the audit committee.
I think so, yeah.
Do we have a second?
Second.
Any comments or questions? If not, all those in favor of the motion, please indicate by saying yes.
Yes.
Opposed? Motion carries. Thank you. Thank you. We'll move to the Mission and Planning Committee. Mr. Greg Carter, Chairman.
Thank you, Madam Chair. The Mission and Planning Committee met on October 6th, and we had 2 items on the agenda. Our first item was the Lakewood Ranch land purchase, and Lori Lang discussed market share in the area, growing demand in population, and the desirable location for development. The initial plan is for location of a first physician group practice and timeshares for specialists with diagnostics. With the recommendation of the committee, I move approval of the purchase of 1.845 acres of land in the Lakewood Ranch on the southwest corner of State Route 70 and Lorraine Road for costs and fees not to exceed $900,000 to be funded from operations and with no amount of the purchase price to come from ad valorem tax revenue as recommended by the Mission and Planning Committee.
Second.
Do we have any questions or comments? If not, all those in favor of the motion, please indicate by saying yes.
Yes.
Opposed? Motion carries. Thank you.
The next item was on information systems, radiology information systems, and Debbie Bohannon discussed the evolution of radiology and how technology has enhanced this service, and an upgrade is needed at this time. The current system is old, inefficient, and is no longer supported. The committee recommended update of this system, and at this time I move approval of the funding for the purchase and implementation of a radiology information system upgrade for a total project cost not to exceed $500,000 as recommended by the Mission and Planning Committee.
We have a motion and a second. Are there any comments or questions? If not, all those in favor of the motion, please indicate by saying yes.
Yes.
Opposed? Motion carries. Thank you.
And that concludes my report, Madam Chair. Thank you.
Thank you. We'll move to the Quality Committee. Mr. Bob Strasser, Chairman.
Madam Chair, I'd like to propose a motion. I move approval of the organ and tissue donor policy and procedure as recommended by the Quality Committee.
We have a motion and a second. Any comments or questions? If not, all those in favor of the motion, excuse me, please indicate by saying yes.
Yes.
Opposed? Motion carries. Thank you. So next is the President's report. Mr. David Verinder, President and CEO.
Thank you, Madam Chair. Let's start today with looking at our leader report card as we do every month. Today is we are looking at our fiscal year FY 2015 as is the end of the year. We'll start in our service pillar like we always do. Looking at our HCAP scores, we had a goal of hitting 9 out of 11 indicators at 50 percentile or better, and I'm happy to report that we did hit that goal this year with a lot of hard work from a lot of people on the staff here to manage that. On the outpatient side of the service pillar, we had a goal of heading to 83rd percentile and likelihood to recommend. I'm happy to report we exceeded that and hit the 84th percentile. In the people pillar, we had merits on time, a goal of hitting at 95%. We came in right at our goal at 95%. In turnover rate, we had a goal of being at 16% or below in turnover, and we came in at 13%, so it exceeded that goal as well. In the quality pillar, the first quality indicator is organization percent of patient safety readiness at 95% or greater. I'm happy to report we did hit that, and we're at 99%. The second item is infection prevention, a combined overall standardized infection rate. We had a goal of being at 0.95 or less. I am to report today that we missed that goal slightly. We're at 0.98. So we did have a small tick up in that number, of which our quality department is working hard on. In the finance pillar, we had a goal of hitting our budget at 4.4% operating margin, and I am happy to report that we have an estimated margin rated in excess of 14%. Certainly that number stands to be
validated by our external auditors, as Bill said, towards the end of the calendar year. In growth, we have strategic growth organizational goal of inpatient admissions. I'm happy to report we exceeded that. We ended the year at 28,042 admissions. And on outpatient registrations, I'm happy to report we exceeded that as well at 690,733. So when we look into it a little closer, we look at our HCAP scores, and you can see in the far right column that says FY15, it gives you what our annual scores are at 9 out of 11. So we came in with two of our goals being a little bit below the 50th percentile, which of course we would like to see them all at that, but very admirable results compared to where we have been in the past and certainly where our other hospitals are. In the likelihood of recommending, you can see like we always do, we have three categories here. We show those that are in the below the 50th percentile, those are above the 50th but below the 83rd, which is our goal, and then of course those are below the 83rd. One we hit at 84th percentile, but you know what really is meaningful is we only have two on the far left-hand side, and I do remember many years where we had a number on that side. So congratulations to all the departments that have been able to shift over. In the people pillar, this is a picture of our clinical documentation team. Sarasota Memorial's Clinical Documentation Improvement Specialists recently celebrated their Special Recognition Week, highlighting their work to ensure that our medical records provides a complete picture of the severity of a patient's illness. And of course, this is paramount to so many things that we do here, from our quality recognitions to our financial stability and ultimately to the best care for a patient. So we thank all these people who play a very important role in what we do here. Also looking at people, we did once again participate in the Venice Area Chamber of Commerce. We held a free expo on October 2nd and 3rd. We had over 1,000 visitors to the SMH table. This is the 28th year for the event, and SMH has participated for the past 8 years. We also did bring out one of our Trudy machines just to kind of demonstrate how that works, which of course we own 3 of, and Alex, we very much appreciate the foundation support in bringing those to the system. Staying in the people pillar, we had a Booker High Career Day Tuesday, October 6th, where SMH employees shared their knowledge and expertise with almost 500 students. You see a picture there of Karen Reynolds, who's an advanced practice nurse, and Rebecca Feely, a clinical practice specialist, and on the other side, Kayla Schleckler, occupational therapist, and Becky Rodriguez, who's a speech therapist, who all presented. So we appreciate their time. So, Alex, I was able to find pictures from the Saks Fifth Avenue event. We had to rush these out, but I couldn't thank you enough for everything you and your team did for that. I think my personal reflection was it was the best one I've been to. So it was very well done, and very much appreciate our physicians, our board members who are all there, and thank you.
And particularly the hospital volunteers that always come out to all of our events.
It's amazing.
They are amazing.
It's amazing how many volunteers we have. Anyway,
thank you.
And I did mention in the write-up here, which I don't think I need to read, but I said 900 guests plus guests. I know it was probably in excess of 1,000, but we prepared the slide at a certain time, and I think you guys were signing people up so fast that we didn't get the last number. Okay. Moving on to quality and safety, our National Case Management Week was celebrated October 11th through 17th with the theme Case Management, a Patient's Partner in Healthcare. And you can just see a picture of all of our case managers here, and they're going to be, of course, added to soon in our capacity project that we're bringing more case managers in. And really, this is the lifeblood of this hospital, being able to move patients in and out of this facility and get them to the right levels of care. And so we very much appreciate everything that they do day in and day out. Going into the growth section, I'm going to concentrate on the right-hand side of the screen first. Sarasota Memorial welcomes one of Sarasota's longstanding pediatric practices into First Physicians Group. Pediatric Associates of Sarasota officially joins the hospital-owned physician network under the new practice name of FPG Pediatrics at Lakewood Ranch. And you have a picture of our 5 physicians there who joined First Physicians Group, starting with Dr. Keeley, Dr. Hurwitz, Dr. Langley, Dr. Suero, and Dr. Shamsley. So we need to extend a huge welcome to all 5 of them. And on the left-hand side, you see a picture of Dr. Jonathan Fong, who has joined First Physicians Group as well as a cardiovascular surgeon. He has already been in the OR and done several cases, quite a few cases, and fitting well into the team. So we welcome him as well. Staying in the growth section, we were recently, sometimes these things pop up and we don't even know that we're in them until our Google alerts hit. But a website called MD Connect recognized 20 hospitals that are using Twitter to attract, engage, and retain patients. And I just wanted to follow up that our report that Sarasota Memorial was ranked number 14 in the nation for what we're doing. So big thank you to Peter Taylor, who's sitting behind me, probably in the last row back there, if memory serves. But tweeting away. But we very much appreciate everything that Peter and his team do to keep us on the cutting edge of social media. And one day maybe he'll let me have a Twitter account. So doubtful, but here's hoping. And that's my report, Madam Chair.
Thank you very much. Any comments or questions for David? Thanks.
Thank you.
We have no consent agenda today. Any public comments? No public comments. Legal matters?
None. Nothing.
No other business unless someone has it to bring up before the group. In that case, we are adjourned.